So here's a bit of an overview of the session that I'm going to run through today, just to show you what I'll be talking about. I want to give some background on this new funding stream and just talk about the overall scope of both of the types of grants. Then we'll be looking at the differences between programs and platforms. Then I'll go over the specific timeline associated with the grant round, partnership with Maori and scoring criteria, and then be opening it up for questions. Over the years, the Foundation has received a number of requests for funding that have been outside our current opportunities, and there's really been no framework for us to assess these. In addition, a review was carried out in 2018 by the previous research manager, Dr. Douglas Ormrod, and the chair of the Scientific Advisory Committee at the time, which was Professor Kathy Stenier. And they collected feedback from a large number of people within the neurological research community. And the idea was that we wanted to ensure our funding was meeting what was needed. And at the time, we got a lot of recommendations just to tweak things, but one of the recommendations was to bring in platform grants, as this was seen as a gap in research funding in New Zealand. So it took a while to implement different changes from the 2018 review, but in 2022, we started to look at the platform grants, and in 2022, I put out a call for volunteers to join a working group. So we had 21 people put their hands up for that, which was great. And I just want to say a really big thank you to all of those in the working group. We had academics and clinicians and research management staff, which was a really great mix. And we didn't really give them much direction. We just wanted to have open discussions about where the gaps were and where the Foundation might be able to meet some of the funding needs in New Zealand that it wasn't currently doing. So the working group presented a number of recommendations to the Neurological Foundation Council, which is our governing board. And included in these recommendations were establishing both program and platform grants. So the general consensus was that it's quite difficult in New Zealand to get 5-year grants to complete a significant program of work, which I'm sure you're all aware of how challenging those grants are to get. And it was also difficult to get funding for platforms that support research. So this can be things like patient registries or longitudinal studies, biobanks, technology platforms. And one of the ones that we do currently support is the Neurological Foundation Human Brain Bank. So the working group helped us to put a framework around these types of grants, and the framework was approved by our council in 2023. So just last year. And the idea was that these grants would be offered when funding becomes available. So this could be through a financial surplus or through a large donation or bequest. And happily, the Foundation had a financial surplus in the last financial year. So the council has approved offering these grants for the first time. So we went out to the research officers and just got some feedback regarding a timeline. And the intention is that our deadlines won't be overlapping with any other major grant deadlines. So we've tried to sort of make it as easy as possible to slot in what's already happening on that front. So looking at the scope, since this call for applications is based on a financial surplus and it's not linked to a specific donation or bequest, it's very general. So it just needs to be in line with the Foundation's purpose, which is to fund research and education into neurological conditions, and the wider purpose statement is included in the guidelines. We also haven't put any limits on being named on more than one application, even as PI, because we know that some of you will be part of multiple collaborations that are looking at this type of funding, so there's no restrictions on that for this round. And we've got a maximum of either $1 million or 5 years for both grant types. And the key here is to be really applying for what you need. So if $1 million can only support your ideal team and budget for 4 years, then that is fine. or if you put together a 5-year grant but won't actually need $1 million, that's also absolutely fine. The assessment will be looking at whether you have the team and the timeline that's needed to achieve what you want to achieve, and you don't need to apply for the maximum. So as usual with our project grants, we'll support salaries for research fellows, research assistants and technicians that don't receive a salary from their institution already. But we've added some additional items for programs and platforms so that you can apply for salary for things like admin and support staff to run the program or platform. And you can also apply for stipends and fees for PhD students. For those who have our project grants, you'll also know that travel is applied for separately with those. So it's important to note with programs and platforms, you should be including conference travel in the budget. And you can also include reasonable publication costs. And publication costs shouldn't include open access fees that can be covered by your host institution's call agreement. We also haven't put a limit on the amount that you can apply for equipment. But the caveat that I would put here is that if it's CapEx equipment that would benefit the host institution outside of this particular program or platform that you're applying for, you need to clearly demonstrate why the foundation should be covering the full cost, or maybe look at a substituted cost model. So yeah, just be a little bit careful there with equipment. And please don't include depreciation, as we see these are indirect costs and we won't fund depreciation. So if your host institution is requiring you to include any kind of indirect cost, the foundation is not actually the right place to apply for funding, because we're fully funded by charitable donations, and we clearly need to demonstrate to our donors where their funding goes. So overheads or indirect costs can't actually be attributed to a particular grant, so we won't fund them at all. And that's a difficult line for many of you, I know, but that's just part of being a philanthropic funder. Now we'll look specifically at the difference between program and platform grants. Program grants are intended to support a program of research that's undertaken by a multidisciplinary team based in New Zealand. So international collaboration is encouraged, and team members can be based overseas, including claiming salary if they're not funded by their host institution. But the idea is that any collaborations will still lead to building capability in New Zealand, because our donations come from the generosity of New Zealanders, and it's important to us that we demonstrate what our funding is building in New Zealand. So program grants are specifically based around a research hypothesis or hypotheses, so that you can be achieving clear research outcomes, and the outcomes need to be making an impact on understanding the causes, diagnosis, prevention, treatment of neurological conditions, anything that aligns with our purpose. Another thing that was raised by the working group was that it can be quite difficult for early or mid-career researchers to take a leadership role in a program grant in New Zealand, but the foundation actually wants to encourage this. It just needs to be clearly demonstrated that any more junior members are fully supported by the more senior members of the team, and all the experience and expertise that's needed is within the team. Co-PIs are welcome, and if there are potential clinical outcomes from your research, there really should be a clinician on the team, potentially relevant community groups, and industry or commercial partnerships can also be included if they are relevant as well. Platform grants are intended to support establishing or expanding a research platform, and it can be of national and international relevance, but it needs to be based in New Zealand. And the important thing for the foundation is that the platform has nationwide reach. As I mentioned before, some of the examples of platforms can be like patient registries, longitudinal studies, biobanks. and technology platforms that can support different groups around the country to do specific types of research. Even if a platform's based at one specific institution, we really want it to be accessible to other researchers in New Zealand. And in the case of patient registries, they should be accessible to patients nationwide wherever possible. So these are really important things to consider. Again, early or mid-career researchers are encouraged to take a leadership role. This is more actually encouraged within the platform grants, and it'd be really great to see co-directorship where that works well also. And platform grants should have an advisory board or steering committee. One of the recommendations that the working group made was for platforms to have ongoing funding, but at this stage, the Neurological Foundation Council has only approved 5-year grants. So we want to see a plan that enables the platform to sustain itself, and it may be a partnership with another charity or government, industry, pharma, lots of different types of possible arrangements, and they can also look very different. So platform grant contracts will actually involve a memorandum of understanding with the host institution, and that will cover how any different arrangements will be managed. And if specific things need to be negotiated, there'll be time for that also after the grant has been offered. Just another note on that, we'll ask our committee and external reviewers to sign non-disclosure agreements for both program and platform grants, just to cover anything commercial that's in there as well. So our timeline is reasonably long, but we wanted to include an EOI stage. We don't really know what kind of applications to expect, and we want to just be able to triage anything out that doesn't really fit with what we're looking for without asking people to do a full application. So the EOI is just a 2-page EOI focusing on what you plan to do, how it fits with our funding criteria, and the type of impact that it will have. We don't require a full budget at the EOI stage, but we do ask for an indication of what range your budget will be in. And this will help us to actually set our own budget for program and platform grants. Our budget will be based on the previous financial year, but also the current financial year. So if we get applications that are less than $1 million, or we have another financial surplus in this current year, we may be able to offer more than one program and more than one platform. So we'll just have to see the applications that we get and also our financial situation at the end of the current year. So sorry, I can't give you any more information on exactly how many we're giving out at this stage. Once the EOIs come in on the 1st of November, we will be putting a committee together, and the intention is that there will be no conflicts at all, which may mean that our committee will be based overseas. It's difficult to see how anyone in New Zealand won't be conflicted on these grants. The neurological research community is relatively small. And as I mentioned, any applications that are not deemed to be a good fit will be triaged out at the EOI stage. And also, if we receive more than 10 applications in each of the grant types, there may be further triage. So as a guide, we'll be looking at taking the top 10 ranked EOIs to submit full application. However, this number is flexible because we don't want to triage applications where the scores are separated by less than 5%. EOI outcomes will be announced on the 17th of February next year, and we'll invite successful applicants to submit their full application, and also the unsuccessful EOIs will get some feedback at that stage from the committee. And then the full application deadline will be nearly 3 months after the invitations go out. With the full applications, we'll be getting feedback from at least 3 external referees. And once those come back, applicants will be given 2 weeks to provide rebuttals. The referees will also be providing the foundation with scores based on the scoring criteria, but the applicants won't be given their scoring details. So what we're looking for is we're looking for the applications that are above satisfactory. So if an average score comes back at satisfactory or less, we may actually triage out some of the applications at that stage. But the committee will consider the referee comments as well as the rebuttals that come back in. And then all applications that receive an average score above satisfactory will be invited to do interviews in late August. So this is where you get to discuss the written application with the committee, how it fits with the scoring criteria, and also anything that came through from the external reviews that needs to be discussed as well. So up to 3 team members can attend the interview, but at least one of them needs to be one of the PIs. After the interviews, the committee will discuss the application, the reviews, the rebuttals, the interviews, put it all together and make a recommendation to the council, and the Neurological Foundation Council then makes the final decision. So they consider the committee recommendations as well as the budget that they've got, and results will be announced on the 22nd of September next year. So the foundation has not actually included a partnership with Māori section in our application forms before. So we're developing this for the first time with program and platform grants. It can include consultation or collaboration, kaupapa Māori approaches to research and ethics, and also aligning outcomes to meet health needs and aspirations as determined by Māori. The overarching idea is that Māori partnership should be linked to your whole research program, not just linked to a particular grant. And different resources are available to help with this within host institutions, but also through organisations such as iwi United Engaged. We're going to be having this section independently assessed by Māori, but it will not be scored. However, if it is essential to your program or platform and is not included, this could affect your scoring, obviously. So, for example, if you're working with patients directly, it's important to consider if there's enough Māori participants to generate statistically significant outcomes for Māori. And it's also important to consider how participants are engaged with from a cultural perspective. So based on what the program or platform's on, this can be a very diverse section. So we'll be just making sure it is appropriate for what's needed for what the program and platform is. Finally, let's look at our scoring criteria, and this will be used across each stage of the review process, including by the external referees. So first of all, we'll be looking at how the program or platform aligns with the purpose of the foundation and also fits the intent of the funding. And as I mentioned before, our purpose statement is included in the guidelines. Our top criteria is always quality. So when we can demonstrate to our donors that we use clear criteria to determine the highest quality applications, it gives them confidence to support us. So the aims and objectives should be comprehensive and demonstrate how they will lead to advances in the field. Obviously, the team needs to have the expertise required to cover all the skills that are needed, including mentoring more junior members of the team and clinical expertise where it's needed. Collaboration is also really encouraged both nationally and internationally where appropriate, including the involvement of early career researchers, industry, scientific clinical input where it's needed. And if collaborators are not named investigators, it's really great if they can provide letters of collaboration to demonstrate to the committee that they have agreed to work with you. The research environment should include access to all the resources required and have a really good track record of impact as well. And one of the foundation's key purposes is education. So for program and platform grants, we have actually included this in the criteria. It can be quite diverse, can include student or trainee involvement, can involve teaching or engaging with patients or community groups. anything that raises capacity within neuroscience in New Zealand, but also teaches people about the importance of neurological research, or teaches them what we know at this stage about particular neurological conditions.